I mean, I had 4 pregnancy losses myself. I don't know if you know this. So I had 4 pregnancy
From your
losses.
book.
Yeah.
I mean, and by the way, I really appreciate the personal story sharing in the book, because it really clearly was in service to your patients and to the reader. And even as a male who can't relate certainly to certain aspects of all this, it was not only very moving, but it was really a testament to just how that sort of thing lands, and then the process of trying to sort out what's real. And it just made me even more grateful for the other information, because otherwise, I mean, it would sort of be like if I'm talking about ovarian health, right? Which I've talked about on podcasts.
Which we're talking about.
Yeah, right, with all the caveats, but of course, how could I possibly know? So your personal experience, well, the reader and I, feel and felt for you in reading it. It is super impactful, because there's a level of trust that just comes from somebody who's been through that whole jungle.
Thank you. I'll try not to cry on this show about it, which is funny because it's so long ago, right? I have 2 children now, had them after this journey, and it was terrible for so many different reasons. Of course, going through pregnancy loss is an emotional roller coaster. I started to have a lot of self-blame against myself. I felt like it was my own body, something was wrong. And professionally, what I was unprepared for is this was the end of OBGYN and then the beginning of my reproductive endocrinology fellowship. So I felt like, how am I going to be a fertility doctor, Andrew, if I can't even get myself pregnant? Right? The professional impact of how it made me view myself and my space, I was so unprepared for, right? Especially in an era where you separate your personal and professional life, which is, what was 100% accepted back then. My last pregnancy loss was an ectopic pregnancy. My fertility nurse had to give me my methotrexate shot. I mean, everybody knew about it. And I felt like a really big failure. And when I sought help to say, it'll happen, just relax, there's nothing you can do, or even just do IVF, felt so dismissive of what I felt like was true as the patient experience. Say, well, what about this symptom, or what about this question? And just really, really pushed aside. And I'll be honest, it made my whole careers different because of it, which isn't that interesting, how sometimes things happen to us that are not ideal and that can be really terrible. I have the 2 kids I'm meant to have, but also I have forever viewed fertility differently. In fact, all my fellowship research was on natural fertility because of it. Because I said at the core, I want to know why some people get pregnant naturally and why other people don't. Like, I really want to know that. I want to do epidemiologic research. I got a master's in clinical research because that research is very complicated to understand. And most fellows do an IVF lab project, which is great, but it's a lot more of a controlled environment. And then I've been so passionate about talking about it since then. And so I think to walk back, what I wanted to say, though, is if you've gone through pregnancy loss, I don't want to ever dismiss how terrible that experience is. And sometimes it can feel that way by me sitting here as a professional and saying, oh, you had a pregnancy loss, so that could be a good sign for the future. And I don't want anybody to ever feel that hearing it, but it does tell us that certain systems are intact.
Recurrent pregnancy loss, RPL, is often defined as 2 or more consecutive pregnancy losses, and guidelines now recommend evaluation after 2 losses rather than 3.
On the other hand, after 2 pregnancy losses, you need an evaluation.
The standard evaluation for recurrent pregnancy loss includes blood tests, semen analysis, sperm DNA fragmentation, and uterine/tubal evaluation to identify underlying causes.
The evaluation is for certain blood tests, a semen analysis, a sperm fragmentation, and a uterine and tubal evaluation. That can be moved up to 1 if you had heavy blood loss, needed a DNC procedure, if your periods have changed afterward, if anything was really off, you can always get tested. And we never want to be in the world where we used to make women go through 3 pregnancy losses before they would get an evaluation.